yourself, Megan?
Yeah, Megan Moore from Kitsap Public Health. I am the Olympic Region Youth Marijuana Prevention Education Programs Lead in my region. I'm happy.
Great, thank you. So today's webinar, to give a little bit of background, this was an idea that was birthed out of a couple of us, Megan's colleague, Lindsay, actually. She and I had joined forces and said, wouldn't this be great if we could make a webinar available to the prevention and public health field about some research that had recently been done. And I've known Dr. Bia Carlini for a while now. I feel really privileged to be able to work with her in different projects. And she happens to live pretty close to me, so an even bigger benefit. And when I got to hear Bia's presentation of this research late last year, I immediately said, oh, can we make this research available to the field of prevention and public health? And her response was yes, but we're going to need to wait until later into the year. And so here we are, being able to host this killer webinar. So today's topic really is about the research that Bia conducted in King County with various budtenders. I think it's really fascinating research. We would really appreciate if everybody went ahead and muted themselves. We'll be able to mute you also. We're going to record today's webinar so that we can have it available, and we're pretty sure that we're going to be able to make it available through the Alcohol Drug Abuse Institute and at their website. So look for information later about the webinar being available. So we have a variety of people who are participating today in our webinar, and Megan is doing the work of letting people in from the waiting room and watching the chat box. I'll also watch the chat box, and so feel free to put questions in there. We'll hold most questions until the end of Bia's presentation. Otherwise, we'll attend to questions about immediate clarification or any logistics that are of challenge. So we have individuals from, of course, the substance abuse prevention field, the public health field, from the cannabis industry, from the chemical dependency treatment field, and from our Liquor and Cannabis Board, from other regulating agencies, from some of our Washington State departments of health and departments of behavioral health and recovery. And we have a variety of participants today from out of state, from California, and from South America. So a wide variety of folks. Really looking forward to hearing some reactions to some of this good information. So again, if you would use the chat box, if you'd keep yourself muted, and if you would introduce yourself in the chat box with your name and your profession or some other identification so that we have a good idea of who all is participating today. So Dr. Bia Carlini, why don't you go ahead and start sharing your slides, and you can go ahead and give yourself even more introduction, and I'll let you get started because you've got the information that we want to hear today.
Thanks so much, Liz. Can you see my screen?
Yes.
Okay, good. So yeah, thanks so much for the invitation, both from Liz and Megan. It's really an honor and a pleasure to be working so close to the people that are in the front lines of doing the real work. And I'm very glad to be sharing today. As most of you, I think a lot of the attendants know, I see a lot of familiar names. I'm a research scientist at the Alcohol and Drug Abuse Institute. I have the honor to lead our work at ADAI on cannabis research and education. So first of all, it's really about who made that work possible. Wouldn't be able to do this work without my colleagues and co-investigators, Sharon, Cashlin, and Robin, and without the funds from Washington State Dedicated Marijuana Fund for research at UW. This is the money that UW receives out of the cannabis excise taxes that are so important on generating in rapid cycles knowledge that can be put to work directly in prevention, education, and policy. And most of all, I'm really thankful for the Budtenders that trust us to and brought to us their experience and their perspectives. We are extremely grateful for their work. So first of all, let's try to situate the people we interview in focus groups. So there are cannabis workers in Washington State. For those that are coming from other states or even overseas, cannabis has been legal for non-medical purposes since 2012. 2014 is when we opened the first stores, and we don't have precise data on how many of workers are now part of this blooming industry in Washington. But if you look at the data available in 2016, we know that about 40% of them work directly in retail in King County, where this work was done around back then, 1269. So we did this exploratory study with them using a harm reduction framework. And that's important to clarify because we are really talking about people that are working in a legal industry and attending and doing a commercial transaction with people that are engaging in a legal behavior for adults 21 and over, and that's the people that are currently in the stores. So there is no point to say, well, cannabis have so many negative consequences that we should send them all home and we should don't do it. I mean, they are there purchasing a legal product in a legal market using a legal established retail environment. So the idea was really what we can leverage on this interaction that can maybe potentially help us to educate on the potential harms of cannabis. And we selected some of the topics ahead of time that we know public health prevention have a lot of interest, and it seemed more conducive of being discussed during this interaction. So cannabis potency and acute cannabis over-intoxication, cannabis use during pregnancy, driving under the influence, safe storage of cannabis once purchased at home to avoid use by kids or and pets. And of course, we wanted to know, first of all, how they perceive their professional role to then put this in perspective. A little bit of methods, then I leave you alone and I can answer questions as they come on this. We recruited the Budtenders online, word of mouth and social media. Our main criteria was that they had at least 6 months of experience in direct contact with customers. And the focus groups happened in 2019, about a year ago, before even the EVALI crisis. Was recorded, and as I mentioned, we use thematic analysis, meaning you can do qualitative research where you just don't have pre-existent themes and you let the themes emerge from the people you are interviewing. In this case, we had themes already, and these themes were what I just mentioned. So how do you see your work, and mostly how do you see these public health topics in your role in it? This is all transcribed and then analyzed in vivo, software for qualitative research. And as typical, you cannot do this alone. You have to always correct for subjective bias interpretation. So we had two investigators doing the work, and discrepancies doing the analysis, and discrepancies were resolved by consensus by a third investigator, that in this case was me as the prime person doing this work. Okay, so that being said, let's get to the juicy stuff. Who we interviewed, how they perceived their roles, education priorities, how they saw the retail space. So first, the sample profile. So our participants, we got 5 focus groups, 19 participants, mostly women, age varying from 24 to 49, median age of 27. They were people that were working before, so the stereotype of, you know, they left the couch of their parents' basement directly to work on the cannabis industry is not. They were actively employed before, 18 of 19 of them, in different works from retail to massage therapists to real estate. You can see also that they report having 1 to 11 years of cannabis retail experience. So if you do the math, that indicates them, several of them were in, most likely in the cannabis retail experience during the time of the medical cannabis only. So they have a long, you know, a lot of them have a long history when it comes to working in the cannabis industry. Last but not least, because this is relevant for everything we are doing, 18 of the 19 participants were daily cannabis users. The other one was weekly cannabis user. And this is the first insight we got still when we are describing the sample, is that their long use and the daily use of cannabis user in this industry becomes an asset that they are proud that they can finally use. So you can see here, well, like we all have smoked, we are cannabis connoisseurs. I'm not gonna lie, we always smoke a lot of weed at our store, and so everything we try in that store, every goddamn product we try, a edible, a tincture, a topical, I mean, we try it. It makes a difference. And when we say here that it makes a difference, it makes a difference as their work is improved by knowing the product they are selling. And it's so important to educate yourself as much as possible and sample as many things as possible and let customers know, this is how I felt, this is what it did for me. I don't know what's going to do for you. Others agree, but this is what happened to me. That happened to me. So that's for sample profile. I'm happy to answer more questions. And then we said, what is your role? And they divided into what I know is my role and what I really don't think is my role. So first of all, and most important to them, having a long history as cannabis users and perceiving this product as something that benefited them in so many levels. And we are not here really to judge if, you know, if that makes sense or not, is their experience and we respect. They want to share this good experience. They want to bring to the customer the good experience they have. So they are talking here more of like, I want to be sure that I'm getting the right type of product for what they want, so they don't get scared away from using cannabis, especially for medical benefits. And here more retail, really talking about the retail, the environment, trying to make sure people have an enjoyable experience, appreciate the environment, and gain knowledge as well. So complementary to this, they also want to help people find products for the experiences they are seeking. It's to have a good experience that match what they went there for. So I'm going to ask them what sort of things they are doing with their day. Are you trying just to have a good time high? Are you trying to get some paperwork done, which is, for me, was a learning curve to see that people would go to the store for getting paperwork done? Are you like trying to clean your house or go for a hike? And then from there, I'll help them to select it. Like, are you looking for some video game weed? Are you looking for some, like, I don't want to fall asleep doing this episode of Netflix? So you can see that they cater for a variety of reasons for use, and they are proud of having the right product for the right experience. They also perceive their roles, and again, I think this goes against some stereotyping we may have about this workforce that were in the shadows for so long, and now they really feel that following the law and the rules is very important. Just because there are a lot of consequences if I don't adhere to the legislation that has been passed in the various laws. So I'm very cautious to make sure that I'm staying within what's legal and trying to remain compliant. So it's a recognition that they are honoring the fact that what was once illegal is now legal per our state laws, and they have to follow if they wanted to be that way, because it's still, of course, federally legal. I'm pretty big on like rules and regulations. Several agreeing, saying, yeah, me too, because there are so many. So if a customer were to come in and buy some stuff and be like, oh, I just need a driving joint too, which happens all the time, I'm the one to just go like, you know what? You said that out loud. I'm not going to sell you a driving joint. So you see clearly here that is adherence to the law mostly, or to the regulations that is of concern to this research participant. And then there are the things that they feel, nah, it's not really my role to do it. So the first thing is not my job to tell customers what they're gonna do at home once they leave the store. Yeah, I feel like that's just not part of the job. It's not our responsibility to keep cannabis out of the harm, out of the reach of someone else's children. It's my job to make sure children don't come to my store, right? Or I 100% treat a pregnant customer exactly like any other customer. It doesn't matter to me what her reasoning is. Like, that's her business, is not mine. So give a good experience, but not get beyond their role as retail. By several participants try to bring that perception of normal role, bringing also the issue about no judgment and support autonomy of adults. So some of the things they're saying is, well, they are 21 and over, they are an adult, it's up to them. After they leave the shop and they take the purchase, is out of our hands. There is nothing we can do, that's their life. I'm not going to judge any customer that comes in the store for anything, but especially not for that, nausea, because I have heard so many good things about it, and that's her business. So the emphasis here, it's her business, not mine, what she's going to do with her body. So that's a little bit really amply, like, this sets the stage for us to think all the things that we ask later, not only the perceived roles, but also how they see their environment, the retail space, which is very different from how they see the bar, a bar that have a whole tradition on the responsible vendor of drinks. So they clearly they limit what can be done in this environment by saying, which makes sense, they are not consuming improperly. So it's not like we are at a bar. We are not serving. They are not having a dab right there and then going to drive in their car. They are just picking it up. So that factor becomes even more salient, first with the laws that you can order everything online and just go there to pick it up, so you don't have that experience of interact much. And second, now with COVID, the exemption that the curbside sales also makes this even more salient. So we can assume that they might leave the premise and continue to go get high or more high or whatever the issue is, but we are not serving them in that way. No, it's definitely a retail experience. few of them complemented this by some kind of idea of, this is not the old times anymore. So some stores are all about the numbers, and we lost from the medical times that opportunity to educate people a little more. It was more about time before. Now is about getting them out of the door as fast we can, because we always have a line. So it has changed that way. It's nothing about customer service, we don't have the time to talk anymore. So it definitely changed. That wasn't the majority, but some people bring, and I think it's probably related to the different retail models that we have in King County. Okay, so what about education then? So we first ask, tell me what is your priority? And their priority had nothing to do with our little list of public health priorities. It had to do with, by the way, a very important issue too, that was more of the pesticides and contaminants. So they say they think that the state has come in and tested and has made sure that it's safe. In reality, the weed that's tested could be from anywhere. They just take the gram sample and send it to the lab. Just because it has a pesticide test doesn't mean that it's even the weed that they are bringing. And that's the biggest misconception for the consumer. They have usually absolutely no idea how the testing is done. So what they are seeing here is they perceive the gap between what was promised and what was the reality in, about a year and change ago. Things have slightly changing in a more transparent and more clear way on the testing part, and they feel very strong about it. Like, this is my passion, this is the product I like, and this product now it's contaminated, and I feel like I have to educate my customers so they don't think just because it's legal, it's tested, and it's safe. So this is what they would bring first and foremost. They also bring and are very passionate about the potency and the acute over-intoxication. That is what we were interested in, and it was on top of our list. They have a different take on it that is really about their passion and commitment with the plant and the good experience that the plant can bring on their lived experience. So they really want to help the customer to get a good experience and avoid the negative. And they know very well, despite some discussions that, well, we are not sure if people are having, well, they say, like me personally, always recommend like to start low, like 5 milligrams a microdose. Like, it's really important to share that information, because someone might freak out and think they are dying, or that this is happening to them and they need to go to the hospital, and that's just from somebody not educating them enough. And the knowledge, the knowledge that you're going to be living with the right product. They are not going to be coming back. I want an indica to relax, and I was up all night with anxiety and panic attacks. So as a public health community, we have been voicing a lot the importance of looking at the potency or the concentration of THC in cannabis exactly because of these negative effects. They recognize these negative effects and also feel like they could educate people on the right product. Driving under the influence, we prompt them. It didn't come as natural. And they have a vision that some people can drive fine, others can't. And if there is intoxication among their customers, it's about drinking and not being stoned. So here goes example. Obviously, if you are the type of person who can't handle weed at all and you drive, that's a horrible decision. The majority of people I know who drive while high, drive better while high, drive slower while high, stay in the lane, are more cautious. Sloppy, not being able to hand over your ID would be, a sure sign that something's going on. So yeah, they smell alcohol, that's just obvious. So it's a case by case in their lived experience, and if problem exists is related to alcohol. What about during pregnancy? So they recognize that there is a lack of evidence that it can harm the baby. So the research is incomplete, which we also agree, but their conclusion on what to do about the still incomplete evidence that it may harm the baby, it's a different take. So I'm a little biased. I was a midwife before I got into the cannabis industry. And really, in terms of research, there just really wasn't anything, at least at the time, that was very conclusive that there were any real risks. And this is one of my favorite quotes, most likely because I'm not from this generation, but it's a good, interesting way of thinking about their lived experience. And let's be real, there's plenty of babies that come from the 70s who their moms were high when they were having kids. Look at the F people. They are 48 years old now. Like maybe not the best generation, but you know, they're alive, they're functioning as human beings out there. So it's really like, I don't realize anything that bad about using during the pregnancy. Also, they make a point that the risks, if exist, should be contextualized. So a person gives their testimony, I had a really bad nausea, and so I only use it a bit. It saved me from the medications they were going to give me. So that sense that the big pharma, the medications could be even riskier to the baby and to herself than using cannabis for controlling nausea. Like if you're pregnant, you are puking every single day, you are miserable, you feel horrible, and you rather use cannabis to make you feel better, to make you functioning enough to make you want to live. So in this case, she's comparing using cannabis or enduring horrible nausea that you feel life is not worthwhile. So again, contextualizing where using cannabis may make sense. So this is what we heard from them. We heard way more than that, but I want to look a little bit of this data and the summaries and also compare with the very few research that I found, particularly on the area of pregnancy, and contextualize when I say few research in terms of how the retail environment perceives it. So the first thing, please, let's always be aware this is a small sample, is specific of the reality of Western Washington. It may be very different in other places. We don't know. That being said, it's important knowledge to be gained so we can think about how we want to work with this workforce. In summary, although in a modest sample, Budtenders are committed and perceived to have appropriate tools to educate consumers in 3 areas. Avoid acute negative experience from high potency cannabis, increase chances of a positive experience with cannabis, and teach consumers about cannabis testing, pesticides, and other contaminants. They also committed with keeping minors far from their business. We had way more testimonies on this, and they really feel very committed about it. Again, the sample that participated in our studies. And this is not small. This is something to celebrate here. Budtenders are not concerned or sometimes even supportive cannabis use during pregnancy or while driving, as you could see in the testimonies that I had in my focus group. And particularly about pregnancy, I would like to bring some thoughts about work done in Colorado and in Eastern Washington. Sorry, I knew I would forget this one. So it's important to bring that despite they are not concerned and even supportive, they left very clear that if materials were produced and mandatory to distribute, they would distribute, no questions asked, again, in the spirit of compliance. So that's important, and they would just put in the bag with the cannabis products. They made that very clear, although they wouldn't bring the topic, and if they would bring the topic, they would be not concerned or supportive. Okay, so the first thing is I wanted to talk about the just published work of Celestina Barbosa Lacker in Wazoo, and she did this work in the other side of the state, where she talks to moms pregnant or just postpartum about their experience of using cannabis. These are moms that were using cannabis before. And I'm getting some of the things she said in a recent statement, in a recent interview with at the Wazoo page. So one of the things she said is that many of the moms she found is many of the moms they spoke, they feel incredibly stigmatized as soon as they report they were using cannabis. And they feel that is unfair because they perceive that they carefully weighted their decision to continue to use marijuana during pregnancy and reevaluated their use through each phase of pregnancy and after giving birth. So they didn't do this lightly or irresponsibly, independently of the position we take in terms of their behavior. They perceived other medications to be more harmful to their baby. Being correct or no, that's what they perceive. They are anti-pharma. They think that this is going to harm them way more than using cannabis and their baby. So they rather use it than use opioids or anti-nausea drugs or antipsychotic medications. Of relevance to what we are talking here is when they feel judged, stigmatized, and not have enough information from their healthcare providers, they are going to, they sought advice from other sources, such as Budtenders. So it's really the two things work together on having the effect of feeling that clinicians are not giving attention, or if giving attention are judging or too fast rushing into this topic of use this medication, and that's not where they are at this moment. So I think it's important to recognize that. The other thing that is important to recognize is that we are not talking about just the Washington state here. And this is a bigger study than ours because it was, less in depth, but also more wide in terms of sample. So, and a lot of you may already know this study because it was published 2 years ago. So it's made in Colorado, and they did this method. It's called secret shopper, where you pretend to be a person, in this case, a pregnant woman looking for cannabis to help with their nausea. And they called 400 dispensaries already in Colorado, of course, during the legal, non-medical, medical are legal, and say, yeah, I'm looking for that, what do you say? So they found that 69% of dispensaries, so out of the 400, recommended cannabis for the treatment of morning sickness with cannabis products. And from this, they recommended, from those, 65 based their recommendation for use in pregnancy on personal opinion, so very similar from what we are finding. And 36 stated that cannabis use is safe in pregnancy. So this is over the board a concern that we have to be attentive and, knowing that this exists. In terms of my next steps as working on this topic, we need more studies, bigger sample, increase external validity. In other words, what we learn in a sample in Washington State of Budtenders willing to talk to a researcher in a focus group, is this something that has more external validity outside the confinements of this kind of study? And it's my strong passion to develop and test interventions where the trust and respect for those that are using cannabis legally can be taken in consideration when delivering interventions. that we recognize that the knowledge that we have now it's still incomplete, and while we feel comfortable to say is incomplete, there are indications enough that this can bring problems, therefore don't use it. That can backfire when you are working on populations that are already engaged on this treatment and have historically a long suspicion about medications, the narrative of doctors, and a lived experience where they basically had to live in the margins of society because of a behavior that now is perfectly legal. So if I think it's important that we discuss, and again, I'm talking about 21 and over legal consumers, don't read anything beyond that on my statements. That will be it for now. I knew I'll be kind of short, have time for questions, and I see we have 45 participants. I'll be happy to answer any questions.
Thank you, Bia. So it looks like we have a comment and a question in the chat box. And so the question I'll start with from Isaac is, he's wondering if the Budtenders that you spoke with shared their opinions on cannabis use disorder, and if they talk with their customers about cannabis use disorder.
Yeah, thanks. That's a great question. They did not volunteer this question, this concern to us. And we didn't select this question or this topic as well because we thought in terms of what they could bring, what would be feasible for them to talk about would probably more be around acute negative effects and not long-term as cannabis use disorder. I think what I could say though is that they all, not they all, but many of them share the experience of not being able to be in the world without using cannabis constantly. So they are very aware of needing cannabis throughout the day and while, there was no opportunity for us to discuss what kind of negative consequences they may experience from that. But they are very vocal about being very long-term users and pretty much probably would qualify for cannabis use disorder, but that wasn't the intent at this point. But good question and of course relevant.
Thank you. So there are a couple more questions, Bia, and again, there's a comment from Diana. She wanted to indicate that she had disagreed with the information regarding pregnant women in the 70s, having to do with different strains of marijuana at that time. So if you have a chance to look at that comment. The next question that I see is, did the Colorado study specify CBD versus THC cannabis products?
Okay, so just for the comment, yeah, I mean, I didn't say I agree with the comment. I just say that they are referring to, the hippie era and the fact that many women smoke cannabis. So I'm not endorsing or disagreeing. It's just an interesting way to to comment on their take of what happened to, they base their beliefs on, their perception of what happened back then. About the Colorado, no, there are no, they do not differentiate between one and the other, CBD or THC. Very few studies do, and they don't.
Thank you. And some logistical questions. Yes, we have recorded today's webinar. Our plan is to make it available through the UW's Alcohol Drug Abuse Institute, which is the organization that Bia is affiliated with. So we don't know how much time it'll take to get into that place and where it'll be located. So give us a few days to be able to work on that. Okay, a couple other questions. Are there known regulations or something in place to standardize the health education? I'm assuming the health education around cannabis is, I'm guessing what that question is referring to.
Thanks for that question. And before we get to when it's going to be available, I think Meg Brunner, our Director of Information Dissemination at ADAI, is in this webinar. She may want to type if she can make available, and what will be approximately the timeline. And maybe an idea is for you, Liz and Megan, to share with us the participants, so we may eventually send an email letting them know that it's available already. About health education, I'm probably not the best person to answer that as a researcher. I know there is plenty of materials out there. I know that you have mandatory display about marijuana use during pregnancy in the Washington State stores. I do not know if there is any intention to do with standardized materials or what that means exactly. Washington, we, Alcohol and Drug Abuse Institute, have a clearinghouse, and we distribute plenty of educational materials for all substance, for that matter, and including cannabis, that are made available by state agencies through federal, state, or county.
Thank you. So another question. This is about other research. Do you have plans to talk to cannabis users, find out who would be considered a trusted source for information about potential health harm effects as a result of cannabis use, or is there another study out there already working on that?
I don't personally have at this very moment any plans on working with that. I would say I'll be thrilled to work with state, county, community-based agencies on developing work that could provide this kind of education. I mean, there are a good amount of education materials for youth that are tested with youth that talks from their perspective. For adults in Washington State, we have basically 2 resources, and these 2 resources were never tested with legal consumers of cannabis. So the first one is in the website we maintain at ADAI. So we have a tab for adult consumers that is well written, is based on science, but it was not tested with the consumers to see, are we talking the language in a way that they don't feel judged? Are we approaching them with the respect of their lived experiences? We never tested. We never had that opportunity. We would need to do this work, and I think it would be great to do it. The other resource is from Washington State Department of Health. There's a good website, and I also helped not to develop, but I was one of the persons reviewing. Know that about cannabis is well put together, is beautifully graphically designed. It has short information, fast to the point. But again, it was, to the best of my knowledge, it was reviewed by experts, but not vetted by cannabis users as well. So this is kind of 101 of public health communication, is to involve your audience, and we have not involved our audience in Washington State. So we might be right, but we might not be effective, which are 2 very different things. And this can be different in other states. Colorado has a different approach. And again, I'm including our own resource on this statement, so bear with me here.
Thank you. There are a few more questions. So in terms of talking with Budtenders, Dr. Carlini, did you hear anything about adverse effects from smoke on the lungs?
No, I did not. It might be because I haven't prompt. No, I did not. They're, they have used in so many different ways, not necessarily smoking, but a lot of them smoking. But we did not had any conversation about it. We could, but we hadn't. It's like there's much as you can do with the time we got.
Okay, thank you. So from some other research that you've also done, Dr. Carlini, do you know if bud tenders are covered by any truth in advertising regulations?
But tenders are the workers of the industry. I mean, they are the retail people, so they are not. They have to follow the guidelines of what they can say and cannot say. For instance, they cannot claim that cannabis have medicinal properties. They they have limitations on what can they do. Like you saw, if somebody says I'm going to use to drive, they may refuse to sell. But no, they don't, as far as I know, and correct me, somebody from LCB if I'm wrong here, they are not bound to any advertising rule.
Okay, thank you. Do we know if bud tenders are high if they're under the influence while they're working at the retail shops?
I don't know that, and I don't think it would be something to ask in this kind of environment, in this kind of research, because by law they cannot consume in the property. So I would have to, prompt if they are breaking the law, if they are trying to find a way to go and use in the streets, which is also not legal. So I don't know. I really don't know.
Okay, thank you. There's a similar question about store policies. If that was something that you covered in your research about store policies for bud tenders about use while working or while being employed.
No, they can't use in the premises or doing work. That's for sure. I have no idea if this is enforced or not. Something that I think is important to mention is that one of the perks as a daily cannabis users that they perceive to have as working in the industry is they have the right to get free samples or heavily discounted products. This is a right they get, a little bit like you're gonna sip or try the wine if you want to sell the wine in a restaurant. So they sample everything, it's legal to sample, and they really have a wide understanding of the products available. But yeah, that's what I know.
Thank you. So a question about curriculum. So the question is, Dr. Carlini, who do you think is the best entity to create a bud tender curriculum in terms of being able to educate on some of the health risks? So there's some awareness that the industry has created their own curriculum, and regulators have been discussing creating a curriculum in-house and maybe looking at third-party consultants to develop that. What entity would you recommend for creating a bud tenders health curriculum?
I would say definitely not the industry. It's asked too much. This is asked too much. It's a non-human task to get the industry that is selling a product to tell all the possible risks of their product. This is a conflict of interest of enormous proportion, and that's not specific to this industry. It's just not the way you're gonna do public health education. I think that in the perfect world, we have to select a state county agency that is willing to clearly educate cannabis users with the assumption that they are already using, they are engaging in illegal behavior. Therefore, maybe this education shouldn't happen. You know, we are not talking about media campaigns. We are talking education that can be delivered in a more target way to them as users and as part of the workforce to then educate other users. So I think that belongs to the public agencies to do. Of course, they could cooperate with several segments of society, and they could even eventually cooperate at some extent with the industry, but it's very different from giving this to the industry as much as that could be convenient. And again, for me, the most important point is the 101 of health education. Involve your audience. Speak from where they're coming from, not from where you want them to be, and otherwise you lose the audience.
Oh, thank you. So there are a few resources that are being offered in the chat box, and I did want to confirm that Meg Bruner, yay, thank you Meg, posted that indeed the UW ADAI will post this recording within 24 hours after they receive it. So, so we're currently doing the recording, and Megan is our administrator for that. So, so it shouldn't take too long at all. As long as we could transfer the file, that this webinar recording will be available in just a few days. And yes, Dr. Carlini will go ahead and send a message to everyone who participated, providing the link for the recording. There is a question about making your slides available separately from the recording. Is that something that you want to consider?
Yeah, let me think about a little bit. The issue is mostly is related to, we are about to publish, submit for publication the results of this study. It takes forever to publish. So, but once it's submitted, this is, if it goes to the step necessary for us academics to then share independently. So let me think about it. If this person can write to me individually, I can consider. My email is right there in the screen.
Great, thank you. Are there any other questions? I think I've covered all the questions. If I missed any, let me know. Yep, just checking the chat box again. Well, it seems that you did a fabulous job, Dr. Carlini. Thank you so very much.
Thank you so much for inviting me. Thank you, audience, for enduring the presentation. I hope you got something out of it, and I certainly feel very privileged to have the opportunity to share my work with you.
Thank you. For me, it wasn't enduring. It's really fascinating, and I really appreciate that you conveyed the quotes directly from the Budtenders, because I think that's really good information. And the field of public health and prevention, especially in Washington State, has been having this conversation about what it might look like to partner in different ways with the marijuana retail industry, and especially with Budtenders in terms of health education and health risks. And so I think you've really shined a light on what the reality is, what the possibilities are, and the places that we may need to wait before we venture into. But this is really, really excellent information, and I am so glad that we finally were able to do this, and I appreciate that it takes time to publish, and so that was part of the reason that it's taken a few months for us to be able to host this webinar. But the information is still really relevant regardless of what the date was when you talked with our Budtenders. I'm hoping that we could see more research as funds become available to be able to look at other angles. I think participants today posed some interesting questions that suggest some places where we could gather more information to be able to help us all do better work together. So that's my piece. And Megan, was there anything else that you wanted to add, or did you want to just thank everybody and help us transition to the 11 o'clock hour?
Yeah, I don't have anything to add, but I am grateful for everybody that showed up, and as you mentioned, we had some different like opposing views in the chat box, and I appreciate everybody coming together on this.
Great, thank you. Well, thank you again, Dr. Bia Carlini. Take care, and thank you everybody for participating today. We'll look forward to connecting again on more information in the future. Have a great week, everyone.
Thank you, and stay safe. Bye.